Diverticulitis. One of your body's most important systems is your digestive tract. Often it works fine without a problem, but small pouches can develop in the colon. These small pouches can form when the inside layer of the tract pushes out through a weak spot. They can be found anywhere along the tract. Most often they occur on the left side of your large intestine. This area is known as the descending and sigmoid colon. The pouches are known as diverticulosis. When one or more of these pouches gets inflamed, the condition is called diverticulitis. Causes. Doctors don't know why some people get these pouches. Certain things are more likely to make these pouches irritated, swollen, or inflamed. There is some proof that diet, lifestyle, and medications can do this. Excess weight, smoking, and not enough exercise can make symptoms worse. Healthcare providers used to think that diverticulitis could be caused by foods. For example, they thought that corn kernels, nuts, or seeds could get trapped inside a pouch. But now this is not thought to be the case. But not eating enough fruits, vegetables, or grains may raise your risk of getting diverticulitis. Symptoms. Having pouches does not mean you will have symptoms, but if the pouches are inflamed, you will likely have one or more symptoms. The most common symptom is sudden pain in the lower belly. Other symptoms include pain when pushing in on the belly, especially on the lower left side, cramping, infrequent bowel movements or diarrhea, nausea or vomiting, fever or chills, loss of appetite. Diagnosis. You may first find out you have pouches when your healthcare provider does a colonoscopy. This is a test to check for polyps or cancer in the colon or large intestine. It's done by placing a thin, flexible tube into your colon through your rectum. The pouches may also be seen if you have an X-ray, such as a CT scan done of your belly. Your healthcare provider can often diagnose diverticulitis from your symptoms. This is easier to do if you are known to have diverticulosis or have had diverticulitis in the past. Your healthcare provider will check your belly for pain. He or she may also do a blood test to see if your white blood cells are high. This is a sign of infection. Take an ultrasound of your colon. Ultrasound makes pictures with sound waves. Do a CT scan of your belly. This is a special X-ray that is guided by a computer. Treatment. Treatment will depend on your condition. A mild case can be treated at home. It'll clear up in a few days with rest. You may need to be on a liquid diet until your symptoms go away. Your healthcare provider may prescribe medications. These can include antibiotics, stool softeners, and pain relievers. If your condition is bad, you may need a short hospital stay. This is so you can get fluids and antibiotics through an IV. In rare cases, you may need surgery. This may be done to drain a pocket of pus called an abscess, or it may be done to remove part of the colon. Prevention. Doctors don't know for sure if pouches can be prevented. Getting lots of fiber in your diet may help to reduce your risk. Be sure to eat plenty of fruits, vegetables, and whole grains. You may also be less likely to have problems if you exercise regularly. Maintain a healthy weight. Do not smoke. Do not take non-steroidal anti-inflammatory drugs or NSAIDs, such as ibuprofen and aspirin. Don't stop taking a medication your healthcare provider has given you. Talk with him or her first. What you can do. Let your healthcare provider know right away if you have symptoms. Also, make sure to cut back on red, fatty meat and other foods that are high in fat. Ask your healthcare provider if you should use an over-the-counter fiber supplement. Quit smoking. Lose weight if you are overweight. Do not take NSAIDs for common aches or pains. What we have learned. Diverticulitis is when one or more small pouches that have formed in the large intestine become inflamed. True or false? The answer is true. The most common symptom of diverticulitis is a pain in the lower belly. True or false? The answer is true. You can't lower your risk of diverticulitis with exercise and a healthy diet. True or false? The answer is false.